Most interesting fact about diverticular disease is that its most dramatic and life-threatening complication, a massive arterial hemorrhage, bleeding, is almost always completely painless. Diverticular disease has two main complications, as we know: diverticulitis, itis. On the end we hear itis means inflammation, infection, inflammation in this case, and diverticular bleeding. So diverticulitis is caused by a microperforation, leading leading to infection and severe abdominal pain, classically in the left lower quadrant. Diverticular bleeding, on the other hand, occurs when a small artery, vasa recta, that drapes over the dome of a diverticular is eroded directly into the colon. This causes an abrupt, large volume arterial bleed. The shocking part is that this happens, my beloveds, in inflamed diverticulum, so there is no preceding pain or warning signs. So a patient can be feeling perfectly fine one moment and suddenly pass a large amount of bright red blood the next. So it's silent, then explosive, a condition that is completely asymptomatic and suddenly manifest as a life-threatening hemorrhage requiring major emergency hospitalization and, of course, blood transfusions, if necessary. The lack of pain is a critical feature in the emergency room when an elderly patient presents with a massive lower GI bleed. The absence of abdominal pain, absence of this pain, strongly points towards a diverticular source, whereas the presence of pain would suggest other causes like, you name it, ischemic colitis or inflammatory bowel disease. Presence of pain. Yes, ischemic colitis or inflammatory bowel disease. So, pain is, most common, of course, in IBS and ischemic colitis. Is the first cause, and this is not a rare phenomenon. Diverticular bleeding is the most common cause, underline it, of a major lower gastrointestinal bleed in the elderly. The most common cause of lower GI bleeding. Okay? Stay blessed.